I did my paper on COVID-19 and mental health. An important thing to know is that the CDC has acknowledged that the symptoms of mental health have increased incredibly, with symptoms of anxiety tripling and symptoms of depression quadrupling since the beginning of the pandemic. So it's definitely a social issue that we should be paying attention to. Mental illness, according to the American Psychiatric Association, are health conditions involving changes in emotion, thinking, and/or behavior. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. Important thing to note is that it's not uncommon. 1 in 5 adults in the US have some sort of mental illness, and they can be treated. People who are able to live happy, healthy lives when they seek help. Overview of Stance 1 talks about the Kaiser Family Foundation, which is a organization that focuses on national health issues. It talked about how the U.S. Surgeon General reminds that the stay-at-home orders are an increasing problem with loneliness, and so that's a problem with public health and mental and physical health. Impacts on adolescents are that with school closures, they have limited access to mental health resources, and then elderly are increasingly lonely. So that's a problem as well. Stance 2 is the Scientific American, and it talked about how media is increasing distress, and that distress causes you to look even more into media. They suggest that limiting media consumption will be helpful to reduce that stress, and then that maintaining social contact is a big thing. It's really hard to find a new normal when you're not talking to anyone, so they really suggest Zoom or phone, anything that is still social distancing, they think is a really great idea for your mental health. Discourse practices. Advising is a big one that I saw in stance number 2. It talked about also in Everyday Talk with Tracy and Robles. Our conversation in floor has changed as well as our expressiveness styles. Talking on Zoom versus talking in the classroom is a totally different conduct. So for us as students, that's a big thing and something that we need to make sure that we're watching because change can be very stressful. What can we do to help? Talk to one another. Talk to your family, friends, and your loved ones. Ask them how they're feeling because it's okay not to be okay. Mental illness is nothing to be ashamed of. And when we talk to people, because the pandemic is hard, we need to learn to lean on each other for support. Talking about small issues is much easier than talking about big issues. So we can start with that. And you can also note that you don't always have to talk to a family member or a friend because you can talk to a crisis center, you can talk to a therapist, or even text one. It's important to note that you're not alone and it's okay to get help. The pandemic is hard on everyone. So every once in a while, it's a good idea to give yourself a break.